This August Assembly, honorable members and observers, a very good afternoon to you all. Mr. Speaker, I take this opportunity to join with my fellow colleagues in congratulating you to the Office of Speaker of the National Assembly during this 12th Parliament, and I do wish you well in your tenure in office. Similar sentiments to the Deputy Speaker, Mr. Schuman, in this Amerindian Heritage Month. I rise today to register my dismay and disappointment at Budget 2020. While budgets are often filled with complicated constructs that give some difficulty to the average reader and follower, this budget made it easy for the masses to debunk the pseudo-economic queries put forward by the presenter of this budget, who strove very resolutely to follow the footsteps of the previous finance minister, Mr. Winston Jordan. But the honorable member fell short and was unable to skillfully or proficiently articulate and deliberate on matters of immediate interest to the beloved citizens of Guyana, let alone indicate to the Guyanese people the government's long-term vision for development for all the people of Guyana. This budget, Mr. Speaker, is full of numbers, but they do not align with the urgent needs of our people. There's hot air blowing everywhere, suggesting that the budget presenter is out of touch with the Guyanese. The budget is indeed defective, deceptive, and discriminatory. It has eroded the fresh approach to the good life in a green economy that the alternative government in waiting commenced in 2015. This budget is abominable because it leaks and shakes. It shakes out every concern for the well-being of the poor and leaks our funds for education, health, and housing. Mr. Speaker, this budget, when stripped of the verbiage, it shows that nothing new has been proffered. There are no transformational projects. Mr. Speaker, most of us are familiar with what occurred following the death of Lazarus, during Bible times. He was resurrected. So we know that story. Jairus' daughter, these were people who were sick or died and were resurrected, resuscitated, and so forth. But we are familiar with that. But certainly we are unfamiliar with the resurrection of projects like the Amira Falls and some of the non-profitable sugar estates. In addition, many of the projects announced by the budget presenter cannot be completed in the next 2.5 months left of this year, 2020, and therefore should not have been budgeted in the first place. In short, Mr. Speaker, what I'm saying, I'm indicating to you that the budget 2020 lacks vision, is devoid of interest, lacks clarity, and has no strategic approaches to guide and make this nation a prosperous one and Guyana great again. There is no clear roadmap to create jobs, to achieve macroeconomic stability, and to free up resources to alleviate poverty. Mr. Speaker, This doctored 2020 budget has shown that the financial dial has been returned to reckless spending with little or no accountability. Mr. Speaker, page 38, paragraph 4.60 notes, and I quote, the APNU+AFC coalition government's neglect of some of the most basic public health programs. Really? Is that true? I must say thanks to Ms. Valda Ann Lawrence, the former Minister of Public Health, because the now Minister of Health, Dr. the Honorable Frank Anthony, has a good pitch and wicket to bat. Mr. Speaker, I know that there is so much work to be done in the public health sector, as is reflected in the malaria and tuberculosis and HIV programs, which are on target to reach their goals. On that note, Mr. Speaker, we wish to observe that Guyana is on the precipice of being declared filaria-free, and the last round is scheduled to begin in October through November 2020. Please, Honorable Member, do not take Guyana backward. So, a good wicket, yes, a good pitch, Mr. Speaker, as the Ministry of Health is the recipient of a new 10-year Health Vision 2020-2030 program to effectively address health inequalities and the social determinants of health, as well as the new strategy to address the HIV situation. Mr. Speaker, we would like to see the continued timely screening for cervical and colonic cancers and for other non-communicable diseases. With the successful passage of that important tobacco control bill during the APNU+AFC's coalition's tenure, we implore the Minister of Public Health to ensure the establishment of a tobacco council to help to enforce the relevant laws. Mr. Speaker, on our taking the reign of office in 2015, we inherited a suicide rate of 34.7 per 100,000. But by 2017, the rate was 24.63 per 100,000. By 2018, the rate fell even more, 18.88 per 100,000. Thus, the evidence shows that the APNU+AFC coalition government utilized the correct approach to lessen the suicide rate and thus moving Guyana from being the country with the highest suicide rate per capita. Of course, if you go by Kwame Street, you will see our newly mental health department. In the same breath, I'm saying, Mr. Speaker, that valiant efforts must be made to achieve the Sustainable Development Goal number 3, the health and well-being of the Guyanese populace. The 3 main pillars for optimal health, namely universal access to public health coverage, universal primary health care, and preventative health must be realized. I must hurry on to say, Mr. Speaker, that appropriate lifestyles must be encouraged to promote good health and prevent diseases. The reckless road and workplace accidents that have a huge social and economic impact and incur much cost to the Guyanese people must be discouraged. Mr. Speaker, the hard-working families in Guyana can ill afford a reduction in human productivity and financial insecurities, but certainly would want the good life as was championed by the former president of Guyana, retired Brigadier David Arthur Granger. Mr. Speaker, on page 57, paragraph 4.107, this government boasts of partnership with the iCare Guyana organization, which continues to provide much-needed glasses to the Guyanese populace and accounts for an increase in the complement of about 13 new optometrists, who entered the healthcare system within the last year. But, Mr. Speaker, in this budget 2020, there is no increase of funding to the iCare Guyana project, which has been brought now under the Ministry of Public Health Program on Disabilities after the funding was exhausted in 2019. There is also a decrease in funding to both the National Commission on Disability and the Tolman Reed Rehabilitation Center. Mr. Speaker, page 77 of 85 at section 613 states, as I quote, "The government plans to remove the corporate tax on private health care as well as VAT on medical supplies." However, in the same vein, Mr. Speaker, I must say that valiant efforts must be made by the Ministry of Health to police the drug supply chain to ensure efficacy of the medical drugs and supplies, while simultaneously seeking to avert the presence of fake drugs from our market. Mr. Speaker, the health of this nation has been always at the forefront of the APNU+AFC coalition government. We were able to establish health units for men and the elderly. There was the completion of the Kingston Bond, while the Diamond Bond was upgraded. There was the construction of living quarters for health professionals in Cameron, Latam. There was the completion of Port Kaituma Hospital, just to name a few. Mr. Speaker, as much as I have outlined some major developments during the APNU+AFC's coalition tenure in health, please permit me to turn my attention to the COVID-19 pandemic. Mr. Speaker, in such an unprecedented time, health advocates and specialists have recognized that there is a conflict between utilitarianism and libertarianism, a struggle involving the imposition of mandated social distancing to protect public health while promoting impassionate efforts to diminish constraints in the interest of individual liberty and economic renewal. It's a time also when healthcare policymakers should focus on ethical issues such as health privacy. Mr. Speaker, in identifying the index case of suspicion for the COVID-19 in March of this year, 2020, the APNU+AFC organized, galvanized, and mobilized all sectors of the government to provide ministerial action plans, containment measures, micro and macro interventions and recommendations, along with exit strategies as to how to mitigate the effects and the impact of the coronavirus. There was mandatory virtual office functionality during the lockdown period. The National Task Force, the NCTF, quickly came into full gear by the former Prime Minister, Mr. Moses Versami Nagamutu. The weekly meetings were held to coordinate efficient and effective containment measures, identify gaps, and offer tangible solutions to the imminent crisis. The intense training provided jointly between the Pan American Health Organization and the Ministry of Public Health was very useful in building the capacity of health professionals and practitioners, and allowed for the efficient and effective management of the health sector in this time of the COVID-19 pandemic. Mr. Speaker, a Center for Disease Prevention and Control, the first of its kind in the Caribbean, was built in record time to allow for the quarantine and isolation of susceptible and vulnerable individuals at home and abroad who did not have access to such facilities in a private setting. Mr. Speaker, the APNU+AFC coalition government managed the COVID crisis in a timely, methodical, strategic, and structured way. One would have thought, Mr. Speaker, good sense would prevail, and that the new government would have endorsed this initiative with open arms and build on the foundation that was already laid by the previous government. The former president, retired Brigadier David Granger, had recognized this dilemma and said, as I quote, "The transnational public health challenges have become frequent and fatal, and with the increase of globalization, there has been an increased incidence and virulence of communicable diseases," close quote. So we know if it's not Zika, it's chikungunya, it's some other thing. So infectious disease is a welcome idea, and we should really work together as a team, TEAM, together everyone achieves more, because we're all Guyanese, so we can work together to make things happen. PUSH, to push until something happens. Mr. Speaker, the COVID-19 cases stand, as of yesterday, at a whopping 1,958, with 598 active cases, 74 new cases, 58 deaths, 1,302 recoveries. Mr. Speaker, the Minister of Health claims that he has a plan. Yet the APNU+AFC government is saying that the Minister of Health is solely responsible for the steep rise in cases seen. An increase of 438% in cases, an increase of 280% of deaths, will reinforce the point that the buck stops clearly at the feet of the Honorable Minister. Guyana has a case fatality of 3%, which is almost similar to America, and you know the population compared with ours, just 250,000, and a positivity rate of 17%. By the way, the case fatality really tells of the degree of severity, whereas the positivity rate tells of the prevalence of the existing disease. And the positivity rate should really be about 5%, so ours is 17%. The Guyanese people would want to see the epidemiological curve flat and plateaued soonest, even in the light of the claim that more testing of symptomatic patients are being done. Mr. Speaker, there needs to be an aggressive campaign by the Ministry of Health to ensure that there is contact tracing in all 10 administrative regions for the coronavirus. There must be a more strategic and targeted approach to address this immediate concern of COVID-19 pandemic. Mr. Speaker, with the constant rise in cases of COVID-19, the government may find it difficult to streamline public health, to downsize teenage pregnancy, and may even find it challenging to reduce mother-to-child transmission of HIV. Does the Mental Health Department have adequate finance? And is there a leap of faith shown so as to cope with the unintended pregnancies due to the lockdown during the COVID-19 pandemic? Mr. Speaker, during this COVID-19 pandemic, there must be a coordinated response as health continues to be decentralized. There must be the stepping up of testing, tracking, and treatment of COVID-19 patients in the 10 administrative regions. And the regional bonds must be stocked up with the requisite resources and personal protective equipment, PPE and gear, and the standard test kits, of course, of PCR tests, you know, because that's the standard test WHO has signed on to, okay, and has approved. And we know that should be made available. Sensitivity and specificity of those tests are very high. Mr. Speaker, it is noted on page 40, paragraph 4.66, that a mere 17 million is placed in the budget 2020 to commence the construction of a cold storage bond in Region 6 to ensure that vaccines supplied to that area do not lose their potency. Just a mere 70 million. Mr. Speaker, there must be a paradigm shift in the way things are done in the country as it relates to the health of the nation, because the health of the nation is really the wealth of the nation. Public health care must be repurposed for COVID-19. Hence, the government must forge ahead with the Smart Hospital Initiative, which included the retrofitting of health structures to make them more resilient, linking structural and operational safety with green interventions. Mr. Speaker, advocates of the core programs of the Ministry of Health must spare no effort to have childhood vaccination programs and health services for cancer screening, family planning, and non-COVID infectious diseases altered, interrupted, or neglected. I quote from Dr. Tedros Ghebreyesus, WHO Director, as I quote, he says, as we prepare for vaccines for this deadly disease, immunization is one of the most powerful and fundamental disease prevention tools in the history of public health. And disruption to immunization programs from the COVID-19 pandemic threatens to unwind decades of progress against vaccine-preventable diseases like measles. We cannot afford any misstep to occur even as we wait the rollout of a possible vaccine, lest the people distrust us and reject acceptance of any vaccine program and potentially undercut all the excellent science and expense that preceded it. Close quotation. Mr. Speaker, as I conclude, the Guyanese people look forward to a caring and compassionate government. The APNU+AFC coalition government recommend that there be health system strengthening to provide vital information, resources, empathy, and support to the most vulnerable population. We further recommend to the government the need to work on electronic streamlining and capturing and the managing of data on patients and contacts. Mr. Speaker, having said all of that, this budget fails to address the needs of the Guyanese people. Mr. Speaker, this budget needs to return to sender. This budget needs to be returned to sender. Mr. Speaker, it is well known that the budget is coming from an illegitimate government who stole the elections from the APNU+AFC and have nothing to offer of value and substance. We will have to press, Mr. Speaker, the delete button. I thank you.